Way Forward is an Aboriginal Torres Strait Islander mental health and addictions project, and we are tasked with improving mental health and addiction outcomes for our community members in Metro North and Metro South areas of Brisbane. We have 3 priorities that we are tasked with addressing, and those are looking at the governance arrangements for our Indigenous mental health and addictions workforce. We're also looking at increasing the cultural capability of mental health services and how they're delivered in Metro North and Metro South. So our 3rd priority is about how do we utilise those relationships with the non-government sector, the IUEs and the Quakes, to ensure that we have a more integrated and culturally sensitive pathway into and out of mental health and addiction services in Queensland Health.
Ultimately, we believe culture is an integral part in getting better health outcomes, but we need services and treatment systems that recognise the importance of that as well.
We can understand the client a lot better, and they can open up to us about the problems that they're having. We very rarely have clients that present voluntary. There's always a crisis or a traumatic event that's brought them into hospital. And just having an Aboriginal person there when they come into hospital, they know that they can then receive the treatment that they need.
The clinicians and the nurses and the doctors look forward for your cultural input, because not a lot of these services know about our holistic approach of services outside in the community. So that's really important for our people, because they've gone through a lot of trauma and they need healing.
Our community members tend to react more positively when they get to speak to another Indigenous person who can translate and interpret what is meaningful for them and their community, and as a result has a much more holistic approach to meeting their needs and the needs of their family and ultimately their community.
Thank you all for being here today. We have a number of wonderful speakers here at the Way Forward Symposium.
We are walking, we are talking. We are gathering on Aboriginal country. So it is very important that we seek permission from the traditional owners to speak here on their behalf.
So the symposium probably had a few purposes. The goal of that was to really celebrate being Indigenous in a Queensland Health workforce, in a Queensland Health context, and demonstrating that there are lots of positives that come with working in Indigenous health. And I wanted to demonstrate that through our workforce and display, some of the great work that our workforce were doing.
I'm inspired by a strengths-based approach that makes a significant contribution to all of human mankind, and all the research which supports my conviction that solutions depend on the ability of all of us to learn and teach and being respectful of both cultures.
Blackfellas understand blackfellas. It's that simple. I speak out a lot on a lot of issues, and to be able to fix our problems ourselves, that's when we'll start moving forward as a huge movement and as a group.
In our commitment to talking up culture within Indigenous health, we must be equally committed and brave enough to talk up race too. For non-Indigenous people, you also need to be equally committed to interrogating your own racialised imaginings of Aboriginal culture, as you are with interrogating the cultural traditions of Aboriginal people.
I've got to present the optimistic outlook, because I really, really do believe there's something really good out there for us. And we're going to get there. But sometimes things like this just knock you around a bit. So I think all of you guys who work in this space have really got to look after yourself.
What is really clear from our symposium and what is clear from the current evaluation and just from the work we've done to date, we need more Aboriginal and Torres Strait Islander workforce members to be available to work with not just our community members as they come into services, but with the non-Indigenous clinicians that work within our services as well, because we genuinely believe that if we can provide highly skilled, culturally informed, empowered Aboriginal and Torres Strait Islander health worker to work within the current teams that exist, then that will have an impact on the practice of non-Indigenous clinicians and just become a bit more flexible and responsive to our needs.
It's just good that you know that that person, we've followed them up from being admission into hospital, they've been discharged, we've been following them up for a few months, and now that we've referred them on to their own GP and they've been followed up with the Aboriginal Medical Centre or their own GP, and then they're not coming back into the service. We've discharged them for good from the service. That's very rewarding.
Being able to make a difference for our family, which is really what we're doing, and our future generations, so that they don't have to be further traumatised by the systems and approaches in the community, is a really good thing. And I think that is cause to, be excited and celebrate.